Welcome to another episode of Healthcare Connections podcast, powered by Healthcare Compliance Pros. I am your host, Jeremy Winn. Our purpose for this podcast is to introduce you to key topics and experts in the healthcare industry to ensure you have what you need to successfully manage your practice. Please subscribe and follow us on our social media channels to make sure you don't miss any new episodes. If you have recommendations for guests or topics for this podcast, email me at jwin@hcp.md. With that, enjoy this episode of the Healthcare Connections podcast. Hello, and welcome to another episode of the Healthcare Connections podcast. Really excited for today's episode. We've got Vinny Sankaran. He's the CEO of Medical Billing Wholesalers. And Vinny and I met in January and found that we've actually got several connections through some organizations. So, Vinny, thank you for being on today.
Thank you very much, Jeremy. How are you doing today?
I'm doing really, really good. So I want to give you a chance to introduce yourself to everybody, to the listeners. And as part of that, you sit on the board for two big organizations in the healthcare space, two that we're also a part of, which is how we got connected. But HBMA and then the NSCHBC organization. So as part of your intro, I'd love for you to also talk a little bit about those two organizations that you're a part of.
Absolutely. No, thank you. Thank you for this opportunity, Jeremy. So I have been in the revenue cycle management for over 15 years. I'm the founder and CEO of Medical Billing Wholesalers, MBW. I tell people we are the BMW of medical billing. I don't put it in writing, but that's pretty much where it is.
I like that.
And we have done a lot in terms of billing, right? The industry has changed over the years with different rules, regulation, HIPAA, high-tech rules, omnibus rule, and so on. So we kind of adapt. And that's one thing I would touch on. So we have about 300 employees doing billing, coding, credentialing. So any revenue cycle needs that people have, hospitals, practices, health tech companies, EMR companies, and also we also help some billing companies that need help to kind of scale. So anybody who needs revenue cycle, that's kind of where we are. So over the years, I've learned a lot about revenue cycle, and you learn by networking, right? So that's why we join organizations, and over the years, I've got into committees and then started chairing committees, and now I'm on the board of HPMA, which is Healthcare Business Management Association. So that is all revenue cycle companies, billing companies in the US and actually across the world. They have companies from India, Philippines, nearshore, Mexico, and so on. So everybody learns because there's so many changes by state, by specialty, different EMRs, new rules. So that's what HBMA does. And I'm really active in that. I'm also the education chair for HBMA, so that also helps, and on the innovation committee. Now, NSCHPC is a little different. That consists of healthcare business consultants. So HBMA is all revenue cycle. NSCHBC is healthcare consultants. So they help business practices, but not only revenue cycle, they can help mostly with taxes, retirement planning. It could be for anything a doctor practice needs. It could be staffing, it could be leasing, it could be buying new equipment, new office building, anything they want. So that's a little different. And both these kind of helped me a lot get a whole rounded view of revenue cycle. Hope that was kind of helpful.
It was, and I can speak, just briefly, knowing, our experience with both organizations. HBMA has been a longtime partner of ours. We have an accreditation program that we do alongside HBMA for the members that they can, come to us, use our services, go through some compliance trainings, and actually become a certified, HIPAA compliance consultant and expert. And then, that nice thing for those billing companies that are part of HBMA is they can get kind of a stamp of approval that they can market and share and say, hey, we want to do your billing and we're accredited by Healthcare Compliance Pros. So you know that we're going to protect your data. We follow best practices, et cetera, et cetera. Because sometimes those physicians get a little bit nervous on business associates who they're working with, making sure that any data they send over, right, isn't going to get them in trouble through a breach that happens with a third party. So it's a great organization, again, that cares a lot about that. And then NSCHBC, the value that I know that it brings to you and to your clients is, you talked about that whole kind of rounded, expertise. Is if you get a question that maybe you're not the expert on, that has something unique, you've got 20 consultants that deal with that specifically that you can lean on. And so Yeah, I think it's a great value that you participate in those organizations.
Thank you. Yeah,
So let's jump in, Vinny. Some of our listeners, many of them probably use a third party billing company, but I know there are also many, healthcare organizations and practices out there that do it in house. And I thought it'd be good to allow you some time here to talk about the value of, what a third party billing company can bring to an organization.
absolutely. That's a great question. So, uh, let's talk the two kinds of billing, right? You can do it in-house, but with all the changes that we talked about, you cannot be an expert in anything. So what happens is we work with a lot of practices. So do you guys, you know how busy a practice gets, right?
Yeah.
So as they're trying to do, let's say they're trying to do revenue cycle, right? They always get distracted. The doctor asks them something, a patient might come in, and usually they get distracted. You can't focus on one thing. That's one. And also, like you said, there are so many consultants for different things. So let's say a contract negotiation. That's not something we do, but I know consultants who do, and that's all they focus on.
Yeah.
So, being jack of all trades doesn't help anymore because don't forget, you're fighting with the insurance companies to get as much as you can. And
Mhm.
they have a lot of money, more than all of us put together, and they're fighting the game of delaying and denying. We know that they don't want to accept it, but everybody knows that, right? So the goal is to pick somebody who focuses on this. Doctors are trained to treat patients. That's their thing. Same with the office managers. They're there to, make sure that they have a good patient experience, and
Mhm.
that's what they should focus on, and leave the billing and chasing after the claims to somebody like us. And that's usually worked out really great, especially after COVID. What the trends we have seen is a lot of practices, even the big ones that had a revenue cycle team, they've lost a few people. So in our case, we do two different things. We either do the full revenue cycle like many billing companies do, right? And we'll say, hey, we'll do this, 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 this. We'll do verification of benefits, prior authorization, your full revenue cycle, and we'll charge you a percentage of billing. We do that for a lot of our clients, but many times we have seen they have a team that they like and love. They
Yeah.
do parts of it. So let's say the verification of benefits or just the patient experience part, and we supplement their revenue cycle team with a few people and we charge them per person per month. So that has been really, really popular the last 4 or 5 years, especially after COVID,
Yeah.
because they have a team that they like. They worked with them for 5, 7, 8 years, but they only have 20% of the team, 30% of the 50, and we supplement the team. So that is also, I've seen something with hospitals, especially, but
Yeah.
also with big groups and practices. So that's the reason I think this industry is so big. HBMA has been there for what, 20 plus years, 25 years. So, and that's grown, right? Offshoring, outsourcing was like a no-no like 20 years ago. Then
Right.
it kind of became important. And don't forget, as the time goes, the companies like us, we start doing higher level stuff, right? 20 years ago, maybe we were only doing data entry.
Right.
Now that's not the case. We're doing complicated appeals, getting credentialing done, working with hospitals. So there's a lot of things that we do, and insurance companies change it all the time. So that's the reason I think it's very important to work with a recognized company. And you want to check, like you said, compliance is very important, right?
Right.
We're not a Sony or a Target or a big Mayo Clinic that if any one of us have a breach, a practice or a billing company, we're out of business. So it's very
Right.
important that you're compliant. I'm sure you understand that's your business. And same with cybersecurity insurance, it's getting tougher and more expensive. So you cannot get that if you don't have all your eggs lined up. So you need the compliance. And that's not an afterthought, say, I'll do it once a year. That's not how it
Right.
works. It's something you do every day. And without that, you're not in business. So we take it very, very seriously.
Yeah. Love that. Um, Talk to me about some of the trends that you're seeing in revenue cycle management, and particularly, private equity is, come into that space heavily.
Oh.
There's a lot of automation tools now.
Mhm.
We've got artificial intelligence that is bringing some tools to the table. Yeah, I'd love your perspective on what you're seeing.
Absolutely, absolutely. So both of them are big trends, right? Before we were talking, like 15 years ago, we were talking about EMRs. Then we talked about HIPAA and high tech. Now the last 3, 4 years, it's all about RPA, robotic process automation.
Yep.
And now the last year and a half, 2 years, it's been about AI and and RPA. So that's one. And PE firms are completely, that's a different one. So let me talk about automation and then we'll touch on the private equity firms.
Yeah.
So automation is there, whether we like it or not, just like EMRs. Now there are automation for many different things, right? Let's talk about a practice. There are AI agents that can actually make it much more efficient and easy for the doctor practices to get in touch with patients.
Hmm.
Because with high deductible plans, it's just got tougher, right? And before a practice, maybe 5% of what they collected was from the patient. Now it's 10, 15, 20% based on their patient mix and higher deductible plans. So it's very important. And you cannot alienate your patients either because, you need to have a good customer experience, patient experience. So there are a lot of tools, third-party tools that use automation, AI sometimes to either make phone calls to the patient, confirmation, to follow up on bills, because sending a patient statement is really old school, right? Everybody has a phone now. Even our clients that we work with in Florida who are much older, 75, 80, they also have a phone. They prefer that or an email. So there are HIPAA compliant options to get that paid, right? To follow up and stuff. Sending a paper statement, nobody likes it. So a lot of tools, that's in the patient side. But there are also AI agents and automation where we can make our work as billing companies faster, but also, the doctors can free up a lot of their stuff. So there are AI assistants for medical coding. You just have a person review it. It depends on the specialty. We can do that. There are AI medical assistants. There are AI scribes. There are interpreters. That's all in the front office side, right? From our side, we have AI or automated. We can do claim status. We
Hmm.
can do verification of benefits. We can do some AR calls, some claims. So whatever we can, it makes us more efficient, and then we can be cheaper and we can pass on that savings to our clients. So AI is something we're doing, and I've been talking about automation and AI at these conferences for the last year and a half, 2 years, and they've been pretty big hit. And we've also had round tables about that, and there's a lot big discussion with practices and with billing companies. So this is definitely something that is happening, and I think working with a company like us is the best way, because the doctor or a practice doesn't have the time to
Correct.
look at all the vendors, uh, to vet them out and see which one is the right fit, what are there. It just is not possible. It's just
Absolutely.
not possible. So that's another reason to pick and work with a company that have done this, they've tested it, and then we tell you, hey, we've worked with so many different ones. This is good. This is a good, it's like we recommend you guys. Same thing.
Right.
A lot of people selling compliance. Not everybody is good, right? Same,
Yeah.
same thing.
Absolutely.
Now, in terms of PE firms, there are two different things. PE firms, so many years ago before COVID, a lot of hospitals were buying up doctor practices. That kind of slowed down because some of it worked, but some of it didn't. There was a lot of pushback from doctors and from hospitals. It didn't do right. Now there are a lot of PE firms buying up. Not only PE firms, United and Optum have
Right.
bought a lot of doctor practices, right? Because they want to control the vertical. Same thing, private equity firms are coming after cardiology practices, dermatology, gastro. Now we are seeing pediatrics practice, primary care, internal medicine, urgent care. So
Right.
they're all over the place. That's one side from the provider side. Then we're also seeing consolidation with hospitals. And in our side, in revenue cycle companies, we've been in 15 years. I haven't seen this at all. But the last 3, 4 years, especially after COVID, when money was cheap, a lot of consolidation with HVMA. So we have all those members, but many of them now, 5 of them have become one company.
Yeah.
There's been a lot of roll ups, right? It's happening with EMR companies, it's happening with billing companies, it's happening with practices. So personal injury has slowed down a little the start of this year, but that could be because of the uncertainty. And I'm guessing it'll pick back up again. So that is also something they should look at. And an organization like NSCHBC is very aware of that because a lot of practices have been purchased. Some of them had
Right.
bad experience, some of them had worked. So it's always good to talk to other practices who have gone down this road with that particular PE firm, then
Yeah.
to see, hey, does it make a good, is it a good idea for you to do that? So there's a lot of things. That's why I think, talking to people in the industry, and that's why we network. That's why we share stories. Not all
Right.
stories are good and not all stories are bad. So, but if you don't talk, we will not know. Hope that was helpful.
That was very helpful. Yeah. Talk to me. Let's a little bit more. You mentioned you do work with some billing companies as well.
Yes.
We have a lot of billing company clients. So I'm curious. What are some of the things that you do when when billing companies come to you and say, "Hey, can you help support us?" I'm sure there's a relationship there. I'm just more curious
Yeah.
what that looks like.
So what happens is because we have an office in the US and office offshore with India, and we have two time zones, that really helps, right? Because it's
Yeah.
nighttime there and morning. So that's one option. The other one is just for scaling, right? At one time, they said there were 15,000 billing companies. I think there are more like 9,000 billing companies in the US, right? A lot of them are smaller ones, mom
Yeah.
and pop,
Right.
3 employees, 4 employees, couple of part-time. So if they want to scale, it's really tough to get people, for revenue cycle. Either it's where they're located or the specialty they do, the EMR, or it's really expensive. So we help them scale. So what happens is these companies, many of them, they have access to some good clients, but they can't take up those clients because they're too big for them. And then so they handle the relationship. We kind of do all the work. So this is something we've been doing for 15
Very
years,
cool.
and we have some big billing companies who have really partnered with us, and we've really helped them scale. Same with EMR companies. But
Yeah.
EMR companies is a little different because they're tech companies, different margins,
Right.
how they look at the world is different. So they partner with us. They handle the tech, we handle the service, and it's been a kind of a win-win. We send some business to them, and they send business to us, and it's been a great, great relationship. So, but with the billing companies,
Great.
same thing. We help them with what they need, and don't forget, we work with 20 different EMR systems.
Yeah.
Sometimes the billing company does not know this specialty or the other one, but they have an option for a client, and we kind of jump in and help them train their employees and so on.
Very cool. I love that. That's a great service, a great opportunity. Okay, so those that are listening that are interested in working with you, I know the website is medicalbillingwholesalers.com. I've got that right.
Right.
Best way to get a hold of you, I'm assuming, go to the website and
There are forms that you can fill out,
okay,
or you could just email me. It's Vinod, Vinod, at medicalbillingwholesalers.com.
great.
There's also a website called mbw.ai that also works. That's like a
Oh, okay.
secondary, because we couldn't get mbw.com because it's owned by a construction company way before us. So,
So .ai, there we go. I love it. Okay, well, thank you, Vinny, for being on the BMW of medical billing, MBW. I love that. I'm gonna
thank you.
remember that one. That's great
Thank
marketing
you.
there. Appreciate you being on today, Vinny.
Thank you so much. Thank you, and have a great day. Thank you, everybody.
Thank you for tuning in to this episode of the Healthcare Connections podcast. For more information on the topic we covered today, you can reach out to me or to our guest. For any additional information on healthcare compliance pros, feel free to email me at jwin@hcp.md. Don't forget to tune in next week. Thank you.